Also. Okay. So I see some people joining. We're just going to wait just a little bit to let everybody get on. Or actually, you know what? Let's go ahead and do housekeeping stuff. That way we can get started right away. So welcome everybody to this week's virtual meetup hosted by the Epilepsy Foundation of Wisconsin. For those that do not know me, my name is Alicia Thompson and I'm the program manager for EFW. We also have John with us this evening.
Good evening, everybody. I work with Alicia at the Epilepsy Foundation. I work mostly with client support services and communications.
Great, thanks, John. And you'll get to meet our speaker in just a minute. I am going to do some housekeeping stuff, like I said. So before we get into the topic, we are doing this in a webinar format. So attendees on the call, you are muted and your videos are also off. We do encourage you to ask questions, whether that's throughout the presentation or we're going to have time for Q&A at the end. But you can submit your questions by using the Q&A button on your screen. You can just click that and type your questions in. John and myself will monitor those. And just know for sake of time, you may not get all questions answered. If you think of something afterwards or your question doesn't get answered, you can go ahead and use our Connect email. And John is going to type that in the chat for everybody so you can see that. Also, we are recording this VMU, so it will be up on our video library on our website, which John will also put in the chat within the next week. So I believe that is all housekeeping stuff. So we're going to get right into it. So tonight's topic is actually our third topic focusing on women and epilepsy. And with us to discuss contraception tonight is Dr. Ann Josiah. Dr. Josiah is an epileptologist and neurologist who specializes in adult epilepsy and treating epilepsy in patients impacted by hormonal cycles and pregnancy. Dr. Josiah graduated from Wake Forest School of Medicine and completed her neurology training at University of Maryland Medical Center, and then went to complete a fellowship in clinical neurophysiology at West Virginia University. She is board certified in neurology, clinical neurophysiology, and epilepsy, and currently participates at the UW Health in Madison, Wisconsin, where she is the co-director of the Women's Epilepsy Clinic. So Dr. Josiah, we're really excited to have you. Thank you so much. I'm going to turn it over to you.
Thanks. Hi, everyone. Thanks for this invitation to talk tonight on, I think, a really important topic that might sometimes get missed when you are so focused on talking about your medications and things like that in your epilepsy appointments with your doctors. So it's good to take a minute and just focus on what might be important to know as a woman with epilepsy who is thinking about contraception. So our goals tonight are broad, just sort of limit them down to a couple. How epilepsy treatment might affect contraception selection, or why you might want to be on contraception, how to minimize the potential interactions of your epilepsy treatments and contraceptive methods, and then consider what impact what you've learned tonight might have on questions that you might want to ask your doctor, either your neurologist or your gynecologist or primary care person, and based on what your personal goals are with regards to family planning. And so this is obviously an important topic to everyone who signed up tonight, but I mean, epilepsy does affect many women throughout the country. There are probably about 25 to 30,000 women with epilepsy within Wisconsin, based on some CDC population-based studies. Last in like 2015 and 2017, they estimated 50 to 60,000 people living in Wisconsin with epilepsy. And so it's, I mean, adults. And so you would estimate about half of those would be people who are women, or people who menstruate, that kind of thing, who might want to be on medication that pertains to contraception. When we think about epilepsy treatments, the mainstay of treatments for epilepsy is medications, the anti-seizure medications, as they're now called. People used to call them anti-epilepsy medications. They like to change the name of everything every couple of years to keep it fresh. Also, epilepsy treatments might include dietary therapy, neurostimulators like the VNS or vagal nerve stimulator, responsive neurostimulators, and deep brain stimulation. And then there are surgical treatments. As many of you may be aware, even if you're being evaluated or have had a surgical treatment, oftentimes you still would need to be on medication. And so those things are going to be part of life for most people, either for several years or potentially lifelong. And given that when people, the time in life when people are diagnosed with epilepsy, there is a peak in early life, late adolescence, early adulthood, and then again in later life. But many people during the time that they would be considered of childbearing age, and that's 12 to 45 years, will be taking an anti-seizure medication if they have epilepsy during that time. And so we want to be thinking about, we don't necessarily want to not be on any birth control medication or contraceptive medication during that time. So there's going to be a lot of overlap in when people are thinking about these things. The mode of contraception that one might select would be based on whether they are thinking about having kids within the next few years, are done having kids, might want to have kids, but not anytime soon, because some of the methods of contraception are more permanent, or at least permanent for several years, and then there's a chance to like change your mind, things like that. We want to think about the potential effects. Let's see, I have to move this window down a little bit. The potential effects of the epilepsy treatments on your contraception, but also how the contraceptive method might affect your epilepsy treatment itself. The potential risk for the anti-seizure medication to impact a future pregnancy. So if you had, if you weren't necessarily intending to become pregnant and had an unintended pregnancy, weren't taking preventive measures to help reduce the potential birth defects that are associated with the medications, there could be extra risk there. So as you probably are all aware, all of the anti-seizure medications do carry some risk of potential birth defects, and we'll talk about that at a later meeting. But if you were actively planning a pregnancy, the medications that you're on, the dosing, things like that, might be able to be changed or altered so that they would be the least risky group of medications that are going to keep you seizure free, and then that could be done in anticipation of a future pregnancy. So planning pregnancy is really the goal of women who are on anti-epilepsy medications or anti-seizure medications. And we also, if we're taking medications for contraceptive purposes, we would like them to be as effective as possible in most cases. And so we want to make sure that we're also addressing that. So anti-seizure medications, like I said, are the mainstay of epilepsy treatment. They are trying to reduce the tendency of the brain to create seizures. You might see the acronym ASM to indicate anti-seizure medications. Most of the anti-seizure medications do get processed through the liver, and that becomes important because that is also where sex hormones, which are used in the hormonal contraceptive, you'll have to go upstairs and see Daddy. I'm doing a presentation. Most of the medications that are used for contraception are also processed through the liver. So the potential interactions between the anti-seizure medications and then the dosing of the contraceptive medications can be affected by these liver enzymes. So I'll get to that in another slide. There are 2 medications that are processed through the kidney and thereby sort of bypass all of the liver processing. And I will tell you about which ones those are as well. So this enzyme that is processing all kinds of medications, not just sex hormones or anti-seizure medications, but most of the medications that we take, prescription medications, are processed through this enzyme called cytochrome P450 upstairs. It is an enzyme in the liver. It helps process medications, and it actually can be impacted by medications. The metabolism of it can be sped up or slowed down because of medications that you're taking. And so if it gets sped up, it's chewing up the other medications faster. So that means if I'm taking a medicine that induces this enzyme and I take a birth control pill that's also going to be processed through this enzyme, then the duration of time that the birth control pill is effective, or the dose that I might need to take of it so that the level is effective in my body might need to be more. So if there's questions about that, please let me know. Hopefully that is making sense. So there are many options for contraception. It's not just birth control pills, but a lot of the different methods do rely on hormones. And these are really 2 hormones that affect women and are important in the menstrual cycle: progesterone and estrogen. There are oral pills that you can take that contain either one or both of those hormones. They can be taken on an everyday basis with a week of placebo so that you have a monthly period. Sometimes people have a placebo once every 3 months. They call it like seasonal periods. Or you can continuously take the pill and have no periods. And that can sometimes impact the fluctuation of these hormones, which could also affect the medication levels. There is, just like the everyday birth control that you might take, the emergency contraception, like the morning after pill is sometimes known. That is also like a larger dose of a oral hormonal contraceptive pill. And the dose of that might also need to be changed based on somebody who is taking a enzyme-inducing anti-seizure medication. And we'll talk about which ones those are as well. Other methods of contraception that are based on circulating like blood levels of sex hormones, like the progesterone and estrogen, include the patch, implants, like Nexplanon. It's an implant that goes into the arm and then slowly releases the hormones that are then keeping a steady state of these hormones in your body. The NuvaRing, which is a vaginally inserted ring, also is slowly releasing sex hormones to maintain a certain level so that you don't have menses or don't have ovulation. And then injections like Depo-Provera. This one actually does bypass the hepatic metabolism or liver metabolism, and so does not, even though it's a hormone that is injected, it bypasses that liver metabolism because it's directly into the bloodstream for a circulating level, and thereby bypasses that impact from the enzyme-inducing anti-seizure medications. Barrier methods would include, I'm gonna totally blank, condoms and diaphragms, things like that. And then IUDs are inserted uterine devices that would impact either mechanically, the copper IUD impact implantation, and or impacting the lining of the uterus so that there's not ability for implantation using a locally secreted hormone. This is commonly known as like Liletta or Mirena. So this is a really low dose of hormone that is just locally affecting the internal lining of the uterus, and then also would not be affected by systemic levels of enzyme-inducing anti-seizure medications. So, like I said, some anti-seizure medications are called enzyme inducers, and these can cause the levels of other medications processed by that cytochrome P450 or the liver enzymes to be chewed up faster or less effective. And this includes not only a bunch of different medications, but also impacts the sex hormones like those used in the hormonal contraceptives. This is on the right side is a list of anti-seizure medications that do induce the cytochrome P450 enzyme. Not all of them do it to the same degree. Carbamazepine, for example, no matter what dose of carbamazepine that you're taking, that will have an impact on ramping up or speeding up the metabolism of other medications through that enzyme system, similar to the esclarcarbazine and oxcarbazepine. But other medications in this list, such as topiramate or Topamax, can have an effect on that enzyme, but it's a dose-dependent effect. So if you see the medications that you're taking on this list, just know that sometimes it does depend on what dose it's on, whether or not it's going to have an impact at all on your hormonal contraceptive, but it might be something to discuss with your doctor. I typically will tell women, like if they're on medications like Topamax, as we might need to go up on the medication, to look out for things like breakthrough bleeding. If you were having no periods on whatever amount of hormonal contraceptive you're taking, and then suddenly we go up on the dose and you're having some like spotting or things like that, I would, take that as a sign to indicate that potentially the level of your hormonal contraception is being compromised or reduced by this change of the anti-seizure medication dosing. And I would use a backup method of birth control like condoms or some other barrier method while that gets adjusted with your gynecologist. So oral contraceptives do include components of sex hormones. As I mentioned, this would include progesterone and estrogen. You probably, if you had attended some of the previous talks, we would know that these two hormones are like sort of in varying amounts depending on where we are in the hormonal cycle with relation to periods or menses. And estrogen is a more excitatory hormone and can sometimes, if it's in a peak amount, can be associated with this pattern called catamenial epilepsy, or make people more prone to having seizures during certain times of the month. So you might think, well, then I want to take a birth control pill that doesn't have any estrogen in it. And there are pills called the mini pill sometimes that are progesterone only. But it turns out that the medications, the hormonal contraceptives that are progesterone only, or these mini pills, tend to not have enough hormone that would override that effect from the enzyme-inducing anti-seizure medications. So we really do want to have, for most women who are on anti-seizure medications, if they're going to take an oral contraceptive, to have a combination therapy medication that includes both progesterone and estrogen. And so we're doing this because we want to consider that the components of these medications might be reduced by taking that anti-seizure medicine. So if you are taking an anti-seizure medication, you might want to discuss with your doctor whether a higher component of estrogen is needed. And we might consider that taking the mini pill would be rendered ineffective by the enzyme-inducing medication, especially if you're on more than one enzyme-inducing medication. It looks like there's a question. Could the Depo shot be considered another form of medication along with any other So yes, that would still be considered a medication that you're taking. The Depo shot would still be considered. Oops. All right, maybe I will stop trying to look at questions because I apparently can't do more than one thing at a time. Previous. How many slides did I advance trying to answer a question? Okay, so, but you do want to consider telling your neurologist about any of the contraceptive pills that you might be taking, even if they, you know, sometimes you just think like, oh, that's just my birth control, but it is considered a medication that you want to talk about, even if it is Nexplanon, even if it is NuvaRing or something that you sort of set it and forget it, even if it is the IUD or Depo, you want to have that in your mind as this is a medication that I'm taking, so that your neurologist knows about it. Yeah. So anti-seizure medications that do not affect oral contraceptive or hormonal contraceptive pills are Briviact or brivaracetam, clobazam, also called Onfi, ethosuximide, gabapentin, lacosamide, also can be called Vimpat, levetiracetam or Keppra, tiagabine, zonisamide, also known as Zonegran, and then valproate, sometimes called Depakote, valproic acid, sodium valproate. Those don't have an effect on the hormonal contraceptive pills the same way that other listed medications do. But there might be other reasons why these medications are better or worse, either for your type of epilepsy or based on the other side effects of the medication. So you don't necessarily want to pick a medication because of it's an enzyme inducer or it's not. There's a lot of other reasons why you might pick the medication. So, you know, we're going to work with whatever you need to be on to give you the best benefit from minimal side effects and excellent seizure control. One particular thing that we might want to think about, a lot of women do end up being on lamotrigine as part of their anti-seizure medication, either by itself or with other anti-seizure medications, partly because this medication does tend to be really well tolerated, but also because, like I said before, all of the anti-seizure medications might have some potential risk of having birth defects if you are taking it throughout a pregnancy. And the potential risk for lamotrigine is one of the lowest among all of the other anti-seizure medications. And so in women who are of childbearing age, this medication often gets selected as one of the earlier things to try. So if you are on this medication and then hadn't been on a hormonal contraceptive or are going to start a new one, that would be an important thing to discuss with both the gynecologist as well as your neurologist. And instead of thinking about it from lamotrigine having an impact on the level of your birth control, it's actually that when you're starting to take an oral contraceptive pill, the hormones themselves can impact the circulating level of the lamotrigine. And for many people, if you have a good amount of cushion on that dose, depending on what level you are of the lamotrigine, the amount that it's a little bit lowered by wouldn't impact your seizures, but it is possible to have the level lowered, and therefore there would be potential risk for breakthrough seizures by starting a new medication. So sometimes if people are going to start a new oral contraceptive pill, we end up needing to increase their dose of lamotrigine. Also, if there's somebody that is needing a very high amount of lamotrigine in their body and is tolerating that fine when they're taking the oral contraceptive, then they go to the placebo week and the lamotrigine level is a little bit higher, they might become a little bit toxic from the lamotrigine, meaning they might feel really dizzy or have sort of double vision or feel off balance because the oral contraceptive that they were taking has been taken away, and now the lamotrigine level raises up a little bit during that placebo week. So sometimes we just need to know that that's a possibility, maybe do a more continuous oral contraceptive, like a continuous pill, or switch to something that's more steady of a level. So those are just things to think about if you're taking lamotrigine and using a cyclical hormonal contraception, like a monthly pill kind of thing, like every day, and then do a placebo week kind of thing. Hopefully I explained that well. Let me know if there's questions that are brought up from that. So I feel like I just breezed through everything really fast, but you know, contraception is important for women with epilepsy so that we can do effective family planning, choose when to have kids, plan those pregnancies, make sure that epilepsy is under the best possible control prior to a pregnancy, for the health of the woman and baby. Also, so that you can potentially modify either the dosing or the medication selection so that the potential impact on fetus or baby is minimized, the risk of birth defects could be minimized, and also prevent unintended pregnancies by selecting appropriate dosing of our hormonal contraceptives. There have been some studies over the past couple of years. I think the last one I saw was in 2017 or 2019 that it was the Epilepsy Birth Control Registry, and they screened women who were of childbearing age. Had they ever had, anybody who was taking an anti-seizure medication, had they ever had an unintended pregnancy, what type of contraception they were using, if any, and what anti-seizure medications they were taking. And the highest percentage of people who had unintended pregnancies among women with epilepsy was due to the combination of enzyme-inducing medications and hormonal, like oral contraceptive pills that may have been inappropriately dosed. They didn't necessarily get into what dose of the pill that people were taking, but that interaction was potentially unrecognized and resulted in unintended pregnancies. So having this information and being aware so that you can discuss with your team of doctors, I think puts you in, you know, one step ahead, puts you in control of, you know, your own health. And so we really want to optimize the plan for seizure control prior to any planned pregnancy, and making sure that you, like I said before, really discuss with your team of epilepsy doctors, and then whoever is prescribing your contraception, be that your primary care doctor or a gynecologist, so that they're aware, everybody's aware of all the medications that you're taking. I will just flip through some references. I'm happy to share those too with Alicia or John if they wanted to share those out, and then any questions, happy to take more.
Wonderful, Dr. Josiah. Thank you so much. That was wonderful. We do have some questions. I'm going to let John start us off.
Okay. Yes, some have come in. First of all, thank you again. That was terrific. The question that popped up is there any anti-seizure medication that is known to counteract contraceptive medication?
That is known to counteract. So that list that I had placed up before, I could try to get back to it, but I can't promise anything. All of those medications, particularly carbamazepine, oxcarbazepine, are probably among the most commonly used ones that are enzyme-inducing medications that would potentially reduce the efficacy of oral contraceptive pills, like the ones that come in the packs, and then some other types of like patches or the NuvaRing that are using a certain level of these sex hormones in your body. So it's going to reduce those sex hormones and potentially make that type of contraception less effective. Okay. It doesn't like completely negate it. It's just like, you know, birth control pills themselves they say like 85% effective when taken perfectly. And we are reducing that 85%. So out of 100 women who are taking a birth control pill, 15 of them might have an unintended pregnancy. And so now we're saying that among 100 women who are taking that birth control pill, it's going to be more than 15. I don't know the exact number, but that is enough that if you're taking this to really prevent a pregnancy, might give you pause to say, I would rather have something that's going to be more effective, because I really don't want to be one of that 15 to 30 people or something like that.
In other words, make sure you have a lengthy discussion with your medical healthcare team before deciding on what to take.
Right, for sure, yeah.
Okay. Is it helpful to use more than one type of contraception? You might have covered that one already, but somebody is asking.
So the answer is depending on what you're doing, possibly. Some of the methods of birth control, and this would be a good question to ask your gynecologist. I'm by no means an expert in contraception, but if you look at the types of contraception, some of them are more effective than others. So the ones that maybe are like the IUD, you have to go in and have a procedure in your gynecologist's office. And then it is there preventing pregnancy with a higher level of protection. So I think it's about 1% of people who are maybe 0.1, it might be 0.1 to 1, so double check me on that, but it's a much higher percentage of efficacy. So out of that 100 women, it's like 1 in 1,000 are having an unintended pregnancy, compared to like the 15 out of 100 taking the oral pill. So much more effective. But if there's somebody who's thinking that they might want to have kids in 2 years, then maybe they don't want to have a big procedure, then have to go back in, have another procedure to have it removed, and that kind of thing. So it really just depends on the personal situation. That's really why you want to involve your team of doctors, because there might be other things that you hadn't considered, or this talk just sort of glossed over, and you want to have it really specified to what your situation is. But if you were somebody who was taking an enzyme-inducing medication and a birth control pill, especially if you're seeing that there's like breakthrough bleeding or spotting, using a backup method of birth control, like a condom or something like that, until you get that sorted through with your doctors, would be advised for sure.
Okay. So here's another one that came in. Is there a single contraception that is best to use overall, in your opinion?
So I think there's probably in like the medical literature a lot of push towards, if you're not actively planning a pregnancy, the most effective method would be IUD, and would have the least amount of impact on other medications that you're taking, and be the least impacted by other medications that you're taking. But again, it would have to be the right kind of person, who's not intending to have a pregnancy in the next couple of years, who'd be wanting to use that.
Okay. See another one here. Would it matter what time these medications for seizures and birth control are taken when talking about interactions, whether taken at the same time or hours apart?
That's a really good question. So it turns out, like, once you're on a particular medication, it's like 5 or more doses of that medication. That's when your bloodstream level tends to be a little bit more like leveled out. And so it probably doesn't really matter what time of day, whether you're taking them together or taking them apart, as far as the impact on each other's levels.
Okay. Let's see here. For the sake of safety, is there a certain age that a woman with epilepsy should be before she should consider taking contraception medicine?
I would say that is interesting. I've never been asked that before. I don't think so. That'd probably be a good question for the gynecologist. But I mean, if you are having periods, then that's something that you'd be ready, as far as I'm concerned.
Okay. Let's see another one here. Is it ever more effective for the man to just use a condom?
So that would be simple as far as no medication interactions there. The rates of like unintended pregnancies related to condoms are probably similar to that, like 80 to 85%. So like the efficacy of condom usage might not be quite the same as IUD usage. And so that's just something that you'd have to consider.
Okay.
They are, I should say also, if you are having unprotected sex with like in a non-monogamous relationship, condoms and other barrier methods are the only ones that are protected for sexually transmitted infections, whereas these other methods that I discussed are not protecting you in that way and are really only effective for pregnancy prevention. And so for that circumstance, condoms would be a great thing to use in addition to the other methods that you're using for pregnancy prevention.
Okay. That is all I'm seeing right now. Alicia, are you seeing anything else?
No, I think you covered them all.
Okay.
Yep.
Anybody that's thinking of asking a question, now would be the time to submit it.
Wonderful. All right. I don't see anything coming through. But if you still are typing, that's okay. We can get to it. But I just want to say thank you, Dr. Josiah, again. This was wonderful. I know we had Dr. Felton on, two weeks ago, or 2 weeks in a row, I should say. And we'll see you again next week. But we've really enjoyed doing this series, and we've had good feedback. So thank you so much for your time this evening. We appreciate it.
Another one just came in
Yep.
here. Are studies being done with brand and generic drugs? I'm not sure if this person is talking about contraception or epilepsy drugs.
Probably contraception.
Yeah.
So with contraception in particular, I'm not sure. I think most of the medication interactions wouldn't really matter based on the I want to say like effective part of the medication, but that's not the right word. But the medication interactions based on how they impact the enzymes and things like that would still be the same for branded medication versus generic medication. Probably the differences among those medications would be more in terms of side effects, like that, potential small amount of the pill or compound that you're taking isn't going to really change like the efficacy of the drug. It's like whatever little side effects that you might feel related to that. So I don't think that would really impact the interaction or the efficacy of the birth control. The studies that are done about drug levels, I mean, they have to meet certain standards in order to be considered to be a generic and still be that same type of medication. I hope that answers the question.
It does, yeah.
All right. I don't see any more at this moment. I see John typed our information in again, so feel free to use that Connect email if you do think of something after the fact. We're more than happy to get the question to Dr. Josiah and then answered back to you at no problem. So really quick before we end, so we do have our fourth and final topic next week with Dr. Josiah, and that one is going to be on pregnancy. So it'll be Thursday, October 28th at 7. So just 1 week away. All right.
Well, great. See you then. Thanks so much.
Thank you. Have a good night, everybody.
All right. Good night.